Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about marcons. Marcons is an acronym for multiple antibiotic resistant coagulase negative staphylococcus. Much easier to say marcons. Essentially, it's a certain type of staphylococcus that can colonize the sinuses, and it's something that's commonly picked up, or people are commonly dealing with this when they have underlying mold illness or mold toxicity, and it colonizes the sinuses and can create a whole mess of problems in addition to the mold that is already causing a whole mess of problems. So I'm posting this video because I posted about marcons a long time ago, and on my YouTube channel, at least, it's one of the most popular videos on there, and someone recently posted a slew of questions related to the topic. So I'm going to start working through those questions because I'm happy to talk about it, and I'm glad that there's interest in this topic. So I just have the questions up here, so I'm going to read them off. So it says, if someone was marcons and biofilm positive, bearing in mind that biofilm is essentially this proteinaceous polysaccharide compound that's created by different microbes. So mold can create it, yeast can create it, certain bacteria like the Lyme bacteria and various other ones can create it, SIBO bacteria can create it. So it kind of creates this protective barrier, this protective shield that the microbes can hide behind. So if the patient has marcons in their sinuses and they have biofilm in their sinuses, how could they best treat it while minimizing detox flare-up symptoms? So that is a very good question, very important question, because when we start breaking down biofilms, which is sometimes crucially important, it can sometimes be the most tumultuous part of a treatment regimen. So just bearing in mind that, as per usual, nothing that I'm saying in any of my videos should be construed as medical advice, and you should talk to your personal health authority before making any decisions about treatment for yourself. I'll just talk about this kind of generally and from my experience. So um, what's happening when you're treating marcons? What's happening when you're breaking down biofilms? Well, when you're treating marcons, oftentimes those microorganisms do not like it when you start attacking them, and so then they might try to fight back in whatever way they're able to. If it's mold, it's going to release more mycotoxins. If it's different types of bacteria or yeast or fungi, they might release certain types of toxins to fight back. Or even if they're not directly fighting back against your attempts to kill them, then as they die, then their bodies don't just magically evaporate. They tend to, the cell wall or cell membrane cracks open and releases a whole bunch of pro-inflammatory material, these things sometimes referred to as endotoxins, into our tissues and create a lot of inflammation. So we want to think about that and recognize that if we kill marcons too quickly, then it could cause this pro-inflammatory after effect. And so one of the strategies that I use with my patients in practice is I start with a low dose of whatever I'm using to kill the marcons in this case, and then I gradually increase the dosage to make sure that they're tolerating it. And if the patient starts feeling worse, then I recommend that they back off on the dose, wait for things to settle out, and then start increasing it again. So that's the approach that I take, because I'm just anti-patients flaring up. And so that's one of the more user-friendly ways to go after something like marcons. The question is always, like, when you're going after marcons, whether you're using something called BEG spray, which is kind of a combination of a biofilm disruptor along with some antimicrobials, or you're using, say, silver hydrosol nasal spray, or you're using nasal rinses, or using essential oil nasal sprays, or nebulizers, or atomizers, or whatever it happens to be. The question is always, like, what are you actually killing up there? Is there maybe mold up there as well? Are there Lyme or co-infections in there? Is there yeast in there? So whenever we start using an antimicrobial treatment up the schnoz, then there's a lot of things that could be growing in there, especially in folks who are dealing with a lot of health issues. So it does beg the question, is one detoxing because of marcons, or is it because of other things that are they having an inflammatory reaction because they're killing marcons too quickly, or is there something else that might be afoot? So going sort of starting low, building slow-ish, not ridiculously slow, but slow enough to make sure that it's being tolerated, and then backing off if things get too intense. That's a strategy that I use all the time. Another strategy that I employ is, if patients, especially if they're really prone to inflammatory reactions, I may recommend that they get some immunomodulators on board, or anti-inflammatories on board before we start really going nuts with killing things off in the sinuses. So in that case, I might recommend things like glutathione or quercetin, or possibly some immunomodulating herbs like red root or red sage, or Chinese skullcap or Japanese knotweed, or things like that. So those are some of the things that I might look at to try to mitigate reactions to marcons. When it comes to mitigating reactions to biofilm disruption, that's a similar answer. Just it depends on, it might be nuanced depending on what we think might be hiding it behind those biofilms. So if, for example, I have evidence or reason to believe that there's mold colonization in the sinuses, and that biofilms might be, or the mold might be hiding it behind some biofilms there, then I'm going to want to make sure that I have my patients on a good mold mycotoxin excretion protocol, because again, as I start killing mold or chasing it out of its hiding place, it's going to release more mycotoxins and the body's going to have to detoxify those. So I'm going to want to make sure that my patients have good liver support in place, good phase 2.5 detox support in place, making sure that they're having their regular bowel movements, they're urinating regularly, and then I'm probably going to want to have a binder in place as well, like activated charcoal or bentonite clay or something like that, to basically mop up all of the mycotoxins that are being released by the cranky mold that no longer has a hiding place behind those biofilms. So that is the tip of the iceberg with these questions. There are a few more built into there, and so or at least, well, maybe not that much actually. I think there's some context there too. I probably should have read that first before going into this. So, anyways, hopefully that answers some. Well, hopefully that gives you some of the information that you're looking for. I will answer the other questions that are in there, and maybe next time before I hit record, I'll read through it again. I read this question, these questions, or this post comment. Probably about a week and a half ago now, so I didn't have it all committed to memory. So anyways, I hope this is interesting for not only the asker, but also for other folks that are listening to this. If you have any questions or comments, please post them below, and I will answer the rest of this question as soon as I can.